now.
Good evening. Cold and flu season in full swing tonight. According to the CDC, it may be sticking around a little longer, but tonight we're digging deeper into why symptoms flare up at different parts of the day.
23 ABC's Tori Cooper is live from Kern County Public Health and has details and tips from health officials that may help protect you this season. Tori?
Tim and Jessica, Kern County public health officials say that every December is when they see the biggest spike in flu cases in Kern County, but that there are still ways to prevent the virus from impacting you and your family. So that's why tonight health officials are sharing details on why symptoms may seem more severe during the early morning hours and at nighttime.
In Kern County, we tend to see the flu pick up in December and January. That's when we tend to see our peaks.
According to the Center for Disease Control, since September, 22 flu-related deaths have been recorded in California, one of those here in Kern County, a resident under the age of 65.
So we've had one so far this year. It's a little bit earlier than we tend to see in Kern County, so we are really concerned about that. And we want to remind people that, flu is here among us.
And last year, a total of 80,000 Americans died from the flu. Kern County Public Health epidemiologist Kimberly Hernandez says the virus is impacting lives in Kern County.
Our peak number of hospitalized and ICU cases are in January and February, and so this is, the kind of time to be really prepared. Obviously, there's a lot of things that are involved with that, the holiday season being one of it, and traveling and being around a lot of people.
According to the CDC, out of all 50 states, right now the flu virus is considered widespread in California, Georgia, and Massachusetts, but the symptoms are the same.
The fever is usually a relatively high fever, so not just a little bit of fever, but a pretty hefty fever. Chills are often very common, and oftentimes it's those respiratory symptoms, a cough, sometimes sneezing and a runny nose, and that sore throat are the typical signs of influenza.
But Hernandez says besides getting a flu shot each year to boost your immunity, you can take some easy steps to protect yourself at home, work, and in large groups of people.
Other things to do are just the good things to avoid germs altogether, is to be really good about washing your hands all the time, and if staying away from people who are sick. That's a hard one sometimes, especially during the holidays, and if you're sick, to be responsible and to stay home.
And Hernandez says many factors can play into why flu symptoms flare up at night and in the morning.
First thing when you get up, you've been sleeping. Sometimes, especially when we have our heaters on, the air has been really dry, things like that. And so that can kind of, exacerbate symptoms, as well as, we've been lying down and our sinuses are all plugged up and things. And then once you get up, then you start noticing and you're coughing things out.
Hernandez says as you wind down toward the end of your day, you also have less distractions, and that's why you may start to notice symptoms more severely, along with many other factors. But she says it's critical to keep your doctors in the loop when your symptoms start to change.
And it just sniffles and you can get by with it. You probably don't need to go to the doctor. If you have a raging fever and you have these awful chills and you can't stop coughing, then it might be a visit to your healthcare provider to evaluate you, to see if there might be something else going on, or if they think that it's flu. The earlier you start treatment for flu, the better the outcome.